Welcome to a video about Aspirin Exacerbated Respiratory Disease, or AERD. This video aims to help you understand more about this medical condition and how it can be treated. Disclaimer: this video is for patient education and should not be taken as medical advice. Please check in with your healthcare provider. What is AERD? AERD, or Aspirin Exacerbated Respiratory Disease, is a medical condition composed of three diseases. 1. Asthma. Up to 50% of patients with AERD have asthma, although it is possible to have AERD without active asthma. 2. Diseases of the sinuses and nasal polyps, which is called chronic rhinosinusitis with polyposis in medical terms. 3. Sensitivity to non-steroidal anti-inflammatories, or NSAIDs. Examples of these include aspirin and ibuprofen. AERD goes by different names, such as NERD, NSAID Exacerbated Respiratory Disease. You may also encounter other names such as Samter's triad. Let's take a closer look at these components and the symptoms that accompany them. 1. Chronic rhinosinusitis with nasal polyps. Typically presents with facial pain and pressure, congestion, and anosmia, the absence or decreased sense of smell. Nasal polyps can be surgically removed, but they tend to grow back in AERD patients. Therefore, treatment with topical nasal steroids is extremely important. 2. Asthma. Asthma refers to the inflammation on the airways inside the lung. Symptoms include coughing, wheezing, difficulty breathing, and shortness of breath. We can treat asthma with inhaled steroids and diagnose it using a breathing test, such as a pulmonary function test. 3. NSAID hypersensitivity. Non-steroidal anti-inflammatory drugs such as aspirin, naproxen, and diclofenac can cause severe reactions in patients with AERD. NSAIDs work by blocking the COX-1 enzyme. In AERD, blocking of COX-1 can lead to a severe asthma and anaphylactoid reaction. NSAIDs that block the COX-2 enzyme generally don't induce such a reaction. COX-2 inhibitors include Celebrex. The dosing of the NSAID can also affect the reaction. For example, someone may tolerate a smaller dose of NSAID, such as 81 mg of aspirin, but react to higher doses such as 325 mg. NSAID reactions can be delayed and may occur up to 3 hours after ingestion. Please note, acute reactions to aspirin and other NSAIDs in AERD can be severe and life-threatening. 4. Alcohol sensitivity. Alcohol can increase congestion and asthma symptoms in about 83% of people with AERD. 5. Other less common symptoms that can occur with alcohol and NSAIDs and even certain foods include flushing, rashes, red watery eyes, general malaise, GI symptoms such as nausea or abdominal cramping. Why does it happen? We do not know the exact cause of AERD yet, and the research is ongoing. When does AERD present? AERD can present anytime, but is most often diagnosed in adulthood. Common age of diagnosis is 34, with symptoms developing over 1 to 5 years. Most often, it's the sinusitis that presents as the first symptom and can worsen with nasal polyps, eventually leading to the loss of smell. Unfortunately, AERD is a chronic disorder and it can last for many decades. What is the treatment? 1. Diet. It has been shown that a diet with low omega-6 fatty acids and increased omega-3 improves the symptoms of AERD significantly. The goal is to have no more than 4 grams of omega-6 per day and have at least 3 grams of omega-3 per day. Examples of decreasing omega-6 include substituting butter 4 small amounts of olive oil, about a spoonful. Avoiding deep-fried foods, egg yolks, and nuts. Examples of increasing omega-3 include eating fatty fish, flaxseed, and chia seeds. 2. Nasal steroids. Nasal steroid sprays are commonly prescribed and are very useful. It is very important that you follow your doctor's instructions. Failure to use nasal steroids can result in increased polyp size. Budesonide nasal rinses also provide relief to Aerd patients. 3. Inhalers. These are used to treat asthma. Usually patients have preventative inhalers which contain corticosteroids and rescue inhalers. 4. Oral steroids. Sometimes they are used in Aerd to treat severe and responsive asthma or nasal polyps. Oral steroids come with significant side effects, and our goal is to minimize exposure. 5. Leukotriene receptor antagonist. Medications such as Montelukast can help decrease the allergy-like effects produced by leukotrienes. Leukotrienes are inflammatory molecules that are present in high levels in Aerd patients. 6. Biologics. Biologics are monoclonal antibodies which are typically injected. They block certain parts of our immune system that cause inflammation. Dupilumab, mepolizumab, and omalizumab are the only 3 approved biologics for nasal polyps as of the making of this video. Biologics are very expensive and can be difficult to access in some cases. 7. Surgery. Unfortunately, most Aerd patients will require multiple sinus surgeries as polyps tend to grow back. Studies show that the quality of life is often much better after surgery. Usually, patients will require continuous nasal steroids, aspirin desensitization, or biologics to prevent the polyps from coming back. 8. Aspirin desensitization. ADT. ADT is a cost-effective way to treat Aerd and prevent nasal polyp regrowth. Furthermore, ADT helps decrease the severe reactions to NSAIDs and can help increase the quality of life. Let's explore ADT further. So how is it done? You slowly take increasing doses of aspirin until you can take a regular strength aspirin, which is a dose of 325 milligrams. This procedure can be done over 1 to 2 days, and it must be done in a controlled medical setting. Typically, you will have a breathing test before each dose to ensure that your lung function is maintained. The target dose or maintenance dose of aspirin desensitization is between 650 milligrams to 1300 milligrams per day. Once you are desensitized to aspirin, you can't miss more than 2 days of treatment. Otherwise, you will need to be desensitized again. What are the risks of ADT? Most patients do not have severe reactions during desensitization. Common mild reactions during desensitization include nasal congestion, watery eyes, itchy eyes, headaches, cough, wheezing, chest tightness, and upset stomach. These types of reactions are transient and can be treated during the procedure. Aspirin slows down blood clotting, so if you cut yourself, you can bleed for a slightly longer time, but it is unlikely that you would experience significant bleeding. Lastly, there is a risk of stomach ulcers. Therefore, you will need to take a special antacid called proton pump inhibitor. Overall, aspirin desensitization is safe in the right type of patient. What are the benefits of ADT? Benefits include decreased polyp growth, decreased need for nasal surgeries, improved sense of smell, and better control of asthma symptoms. In addition, there's decreased use of oral steroids, and once you're desensitized to aspirin, you could tolerate other anti-inflammatories. Where can I get ADT? You should check in with your local health authority. In the province of British Columbia, the main center for aspirin desensitization is located at St. Paul's Hospital at the Aerd clinic. The clinic was created by me, Dr. Ruiz, and my good friend, Dr. Tambu, from ENT. He is a surgeon with a special interest in nasal polyp surgeries. We're passionate to deliver multidisciplinary care to patients with AERD and improve access to ADT, surgery, and biologics. Please see the link below to get more information about the AERD clinic. This concludes the video on AERD. We hope this video has provided you with some useful insight into the medical condition and how we can treat it. If you have any questions, please visit Samter Society website. The link is below. If you are a resident of British Columbia and wish to be referred to the AERD clinic, please talk to your care provider and ask for a referral. The referral form can be found on Pathways. We look forward to seeing you.